Now, time is running on. We have a panel discussion, and we have Kasia Imonen Sharalambu, Sabine Brosch, and Barry Arnold, who are also on the panel with us. Kasia representing the European Patients Forum, Sabine Brosch, who is the Eurovigilance business lead here at the European Medicines Agency, and Barry Arnold representing FPEER. So I think we're open for 5 or 10 minutes of further discussion if we should want. Can I perhaps first start by asking Kasia if you'd like to give any specific comments? I don't know if you have a slide or two, or whether you'd just like to give some oral comments. Over to you, Kasia.
Thank you very much. I would first of all like to thank the speakers for an excellent series of presentations. It's really great that I don't have to argue that patient reporting is a good thing. I think that's pretty clear. Just a few points from the perspective of our members. EPF has at the moment 50 member organizations across the EU, and many of them are themselves umbrella organizations. We held a workshop recently on the new pharmacovigilance legislation at our annual general meeting, and one important message that came out of that workshop was that there is at the moment quite a low awareness, even among the patient community, not just about direct patient reporting, but about pharmacovigilance, what it is and why it's important. And that's why they stressed that in order to have an effective implementation of the new rules, patient communities really need to be informed, even with quite basic information about these things and how the new directive will help make medicine safer, and why is it important that patients report adverse reactions and what avenues are available for them. And also, we do think that national authorities and the Commission and the agency possibly should organize information and awareness campaigns. But the UK experience also appears to show that the effect wears off after a while. So I think patient groups here and consumer organizations too can do very valuable work in supporting this awareness in the longer term, because we are in regular, constant contact with the grassroots patients and consumer communities. And also regarding the systems for reporting and how, I think here the challenge is how to actually make use of this wonderful information that is being reported by patients. The system should capture the special richness of these reports. And it should also be considered in the way that the reports are processed and in the way that the feedback is organized. In terms of the feedback, it could be difficult, of course, to give individualized feedback to every person, but to really foster the motivation for reporting, I think it's important that at the minimum there should be some information about how the information will be used. What is the benefit of actually having turned in this report, and if appropriate and wherever possible, some further feedback, as Albert van der Zijden also pointed out. And one thing that's really important in the new rules is the inclusion of medication misuse and errors in the kind of things that will be now monitored more closely. I'd also like to say that our members have highlighted the need for capacity building for patient groups at national level. They would very much welcome a specific training program on pharmacovigilance and on how it's going to be implemented, how it's going to work at national level, and what they can do to contribute. They are very keen. At the same time, they feel that there is a lack of information and also sometimes a lack of a working relationship with the national authorities. So again, perhaps EMA could play a facilitating role here. I know I'm putting a lot on your shoulders, but it would be very helpful, for example, to organize a capacity building workshop to involve patient groups and also member state representatives together. If I may just make one final point, it's very clear, especially from Ilaria's presentation, that there is a need for training and education of health professionals as well, not just in encouraging them to report better and more, but also in listening to patients and involving the patient more, because our rationale here is not that we want to tell patients, okay, now you can report directly, you don't have to speak, you don't have to involve your doctors anymore. On the contrary, we think this is a chance to strengthen the doctor-patient relationship and also the role of other health professionals like pharmacists, like nurses. So this one report put it very nicely, I think it was by HAI. Direct patient reporting is both an expression of and a contribution to health literacy and empowerment, and through it, patients can be encouraged to get more involved in their healthcare in general. So I think patient groups and healthcare professional groups should take this opportunity to really promote best practices in shared decision-making and concordance. I think it's a great chance and we should work with it. Thank you.
Thanks very much indeed. Sabine, having heard the various presentations, are there any observations you'd like to make now?
I think I will come back later on when we discuss ultravigilance.
Okay.
Of course, there are important aspects, but maybe in the interest of time, I will come back later. Thank you.
Thank you, Sabine. Barry Arnold from representing FPIA today. Any observations you'd like to make before we close?
Thank you, Peter. Just very briefly indeed. I mean, FPIA very much supports the concept of patient reporting. We very much share your thoughts, which is it's time to move on from what feels like an age-old debate about whether patient reports have value, to really how do we get the greatest value from patient reports, and how can patient reports complement those from healthcare professionals. In specific terms, I think what we would like to see is that patient reports are treated in the same way as healthcare professionals, starting from the point of data receipt and data entry, and that the tools provided have got to facilitate high quality patient reports, user-friendly forms, and yet comprehensive data. In particular, we'd like to be able to receive from patients batch numbers or lot numbers, most especially for vaccines and biologicals. There's no reason why, if a report comes from patients, we should still not collect that data. We ask for it from healthcare professionals, we should ask for it from patients. And then just to share Mick Foy's closing point, duplicate detection will be key. Thank you.
Thanks very much indeed. Now, my understanding is that there's coffee and tea outside, so just before we break, to the two co-chairs of this afternoon, I've understood from what I think was a very rich hour and a half that the time is now for patient reporting. The value of patient reporting has been demonstrated through research beyond debate. Patient reporting is going to be critically about a member state involvement. And the way I see the new legislation is that the new legislation makes patient reporting a right for patients, and it's an obligation on the member states to make sure that patients can report. Clearly, we've also heard that healthcare professionals must continue to have an important role, and that it's not patient reporting or healthcare professional reporting, it's getting the best from both groups. We've heard about capturing the richness and making sure that we have appropriate feedback to patient reporters. We've heard about training and capacity building, and 3 different presentations specifically stated that patient reporting had been demonstrated to have contributed to signals, so new or changing safety issues. And I thought the intervention from the patient forum relating to health literacy and empowerment was very important. So on behalf of the agency, thanks to all of those who have made a presentation this afternoon on what I think is a really important, new and exciting area where, in time, we're going to be able to make a really, really big difference. So thank you very much indeed.